Many patients are conditioned to mask vaginal odor with commercial sprays, dusting, powders, or specialized washes. However, a crucial clinical reality often goes unacknowledged. Much of the prevailing information regarding vaginal scent is scientifically misleading. As a clinician, I have observed countless women transition from years of quiet distress, avoiding intimacy, worrying about partner perception, and hesitating to consult their physicians, to finally achieving comfort and renewed confidence upon understanding the underlying physiological changes in their bodies. This perspective is precisely what we are exploring today: the common, yet concerning, errors made by many women over the age of 60 regarding vaginal hygiene, and the evidence-based strategies to maintain a healthy, balanced state safely. Welcome back to the Female Health Hub, where we integrate scientific data, which historically has often focused on male physiology, with practical, evidence-supported remedies and the collective experience of women across the life spectrum. I am Dr. Lily Stones, and I have dedicated over 30 years to women's health, closely attending to their concerns and guiding them through life changes that are too often shrouded in silence. Today, we are undertaking a detailed exploration of the etiology of vaginal odor after the age of 60, why its characteristics change during this life stage, and most importantly, the appropriate, non-shaming, and low-risk interventions. This is vital, given that a study published in the Journal of Menopausal Medicine confirms that postmenopausal estrogen fluctuations directly impact the delicate vaginal microbiome balance. Understanding this relationship is the first step toward a reasoned, rather than anxious, response. Understanding the hormonal shift and the microbiome in the premenopausal years. Vaginal scent is predominantly influenced by factors such as the menstrual cycle, pregnancy, or dietary intake. After age 60, the narrative shifts due to distinct systemic changes. One of the most significant changes is the decline in estrogen. During and following menopause, reduced estrogen levels lead to the thinning, decreased elasticity, and reduced lubrication of vaginal tissues, a condition known as Genitourinary Syndrome of Menopause, a GSM. This does not solely impact comfort during coitus, it fundamentally alters the local environment that controls odor. The healthy vagina relies on beneficial bacteria, particularly lactobacilli, to maintain a protective, slightly acidic pH. This gentle acidity is key to inhibiting the overgrowth of pathogenic organisms and preventing odor imbalance. With diminished estrogen, the lactobacilli population naturally decreases. Consequently, the vaginal pH rises, becoming less acidic and more neutral, which is when novel scents may emerge. For some women, this change is subtle, a faint mustiness or an earthier scent that was previously absent. For others, the change is more pronounced, involving stronger smells, new irritation, or altered discharge. Because this change is typically gradual, many attribute it to simply getting older. However, it is crucial to recognize that vaginal odor post-60 is not solely a function of estrogen. Other life factors contribute: medication use, certain drugs, such as antibiotics or hormonal blocking agents used in breast cancer treatment, can disrupt the microbiome. Clothing and moisture-wearing occlusive, tight synthetic fabrics, or the presence of moisture from mild bladder leakage, urinary incontinence, can create a local environment conducive to bacterial overgrowth. Local environment. Prolonged sitting in warm clothing can increase local perspiration, and the mixture of sweat and skin bacteria creates its own scent profile. While hormonal and age-related changes are central, lifestyle, underlying health conditions, and even stress can influence the body's scent compared to decades prior. The key takeaway is these changes are common, but they are not an unavoidable fate to be endured in silence. Understanding the shift enables the adoption of strategies that genuinely support health, rather than defaulting to the quick fix mistakes that are unfortunately widespread. Now that we have established the physiological basis for changes in vaginal odor after 60, let's address the counterproductive actions often taken to manage it. If you recognize these actions, please know you are not alone. They are frequently observed even among highly health-conscious individuals. The first major mistake is douching. For decades, commercial entities have promoted douches as a solution for freshness. Clinically, they are detrimental. The vagina is a self-cleaning organ with an optimized, innate mechanism for maintaining balance. Washing the area out with perfumes or chemical solutions strips away the protective lactobacilli, increasing susceptibility to infections and the development of stronger, often more pathological odors. The second mistake is the reliance on scented sprays, powders, or specialty feminine washes. While these products are sought out by women seeking a solution to embarrassment, they offer only temporary masking while subtly disrupting the natural vaginal pH. Over time, this localized irritation can paradoxically worsen the odor, trapping women in a cycle of product dependency and frustration. The third mistake is ignoring persistent or pronounced odor changes. Although subtle shifts are natural, a sudden or strong odor, especially one accompanied by unusual discharge, green-gray, or unusually thick, pruritus itching, or dyspareunia pain during intimacy, is a clear clinical indicator of a condition requiring attention. Dismissing these symptoms out of shame or fear often permits minor issues to escalate. Another pervasive error is the adoption of unproven internet or anecdotal home remedies. Practices like inserting garlic cloves, using apple cider vinegar baths, attempting herbal detox, pearls, or consuming large, unverified amounts of specific foods lacks scientific validation and can pose risks. I have treated patients with significant chemical burns or protracted infections resulting from such interventions. If a purported remedy seems excessively simple or promises magical results, a healthy degree of clinical skepticism is warranted. Finally, the mistake that requires explicit naming is silence. Many women endure odor-related anxiety in isolation, never consulting their physician, partner, or close confidants. The stigma surrounding this aspect of health is profound. Yet, this silence prevents access to safe, evidence-based, and effective solutions. The encouraging news is that these mistakes stem from a single, understandable motivation: the desire to feel clean, healthy, and confident. Once appropriate biological understanding is acquired, the pursuit of genuine health can supersede fear and the reliance on quick fixes. A crucial component of achieving peace with one's body is discerning the difference between a natural scent variation and a symptom requiring medical evaluation. Not every odor is a clinical problem. Some are merely reflections of the body's natural chemistry. A patient once presented, deeply concerned that her postmenopausal vagina had acquired a new, faintly sour or tangy scent. She had undertaken repeated showering, changed detergents, and altered her diet without success. When I explained that this was the normal acidic odor generated by her healthy, protective bacteria, she was overwhelmed with relief. Her self-doubt and stress evaporated upon realizing the scent was a sign of a body functioning as it should. A light, slightly musty, tangy, or subtly earthy scent can be considered normal. Minor perspiration in the groin, negligible bladder leakage, or prolonged wear of warm clothing can contribute to a mild, transient scent, which does not signify pathology. However, certain odor profiles constitute a red flag. If the scent is persistently strong, fishy, or malodorous rotten, especially when accompanied by discharge that is green, gray, or otherwise unusual, it is a signal for prompt medical assessment. Similarly, if odor coexists with itching, burning, or dyspareunia, a clinical evaluation is essential. Conditions such as bacterial vaginosis, BV trichomoniasis, or candidiasis tsetse yeast infection are common causes of odor changes, and while they are uncomfortable, they are readily treatable with an accurate diagnosis. I recall a woman in her 70s who was tormented by what she described as a metallic scent. She attributed it to the unfortunate burdens of aging. Upon examination, we identified subtle tears in her dry vaginal tissue, causing minute amounts of bleeding. The trace blood, mixed with natural secretions, created the metallic smell. With appropriate management to restore tissue moisture and healing, the odor, and her associated embarrassment, resolved. The truth is, odor itself is not the enemy, it is a communication. Sometimes it conveys balance, other times it warns of a shift requiring care. The clinical challenge is cultivating a mindset of curiosity over shame. This shift moves one from fear toward informed decision-making. Knowing the distinction between normal and abnormal is the first step. The next is implementing solutions that genuinely support health without the risk of quick fix remedies. the most potent and fundamental intervention is restoring moisture. As estrogen levels decline post-menopause, the resulting tissue thinning and dryness fundamentally disrupt the bacterial balance. This dryness is a key contributor to odor alteration. The use of a clinically safe vaginal moisturizer, or, if indicated and prescribed by your clinician, low-dose vaginal estrogen therapy can reestablish a healthy equilibrium and significantly reduce unwanted odor. I have witnessed this single intervention dramatically improve patient comfort and confidence. The second step involves breathable clothing choices, prioritizing cotton underwear, loose, fitting outer garments, and minimizing prolonged exposure to tight, synthetic fabrics. Trapped moisture and sweat are a primary source of bacterial proliferation. Allowing the area to breathe assists the body in maintaining its natural balance. A gentler approach to hygiene is also vital. Overwashing, scrubbing, or using scented products interferes with the vagina's self-cleaning function. The external vulvar area requires only mild, unscented soap and warm water. The less interference, the more stable the internal balance remains. Hydration is a deceptively simple yet important factor. Adequate water intake supports the body's natural waste elimination and helps maintain the integrity of mucosal tissues. Dehydration can exacerbate vaginal dryness, which, as discussed, can intensify odor. Finally, pelvic health is a critical piece. Mild urinary incontinence, common after 60, can cause a chemical or bleach-like scent due to urine residue. Employing absorbent pads specifically designed for leaks, rather than standard panty liners, and engaging in regular pelvic floor exercises can minimize leaks and the associated odor. Perhaps the most essential solution is this: consult your physician when symptoms are concerning. Though discussing vaginal odor can feel deeply uncomfortable, remember that your clinician has extensive experience with these issues. Obtaining an accurate diagnosis means discontinuing guesswork and random remedies, allowing for the initiation of effective treatment. The ultimate goal is not to compel the body to emit an artificial perfume scent, but to support its natural balance, enabling a feeling of cleanliness, comfort, and confidence. My clinical experience is replete with stories of women who have endured years of silent shame over this issue. I recall one patient in her mid-60s who ceased attending social events because she feared others could detect her odor. She used mints and perfume as desperate attempts to mask her anxiety. Our open discussion revealed she had bacterial vaginosis, a common and straightforwardly treated infection. Within weeks, the odor resolved and her social life resumed. She reflected, "Dr. Stones, I wasted years hiding when all I needed was to ask for help." Another woman in her 70s confided that she had withdrawn from intimacy with her husband due to body self-consciousness. Together, we initiated a regimen of gentle vaginal moisturizers and localized estrogen. Her tissues healed, the odor resolved, and she regained her confidence. Months later, she shared, "I feel like a wife again, not just a patient." These narratives underscore a shared reality. Embarrassment, isolation, and worry are common, yet safe. Effective solutions exist. The most powerful transition occurs not just biologically, but psychologically, when a woman recognizes that vaginal odor is a message from her body, not a sign of uncleanliness. She moves from shame to self-respect. If you have experienced changes in your body that cause embarrassment, uncertainty, or isolation, please internalize this: you are not alone, and you do not need to suffer in silence. Vaginal odor after 60 is a common occurrence with clear physiological underpinnings, and crucially, it has gentle, evidence-based solutions. What I advocate for is freedom from ineffective sprays and powders, freedom from damaging myths and quick fixes, and freedom from the shame that silences too many. Here in this community, we prioritize open discussion of topics often whispered about, because every woman deserves to feel clean, comfortable, and confident in her body, regardless of age. I invite you to share your experiences below. Your story does more than help you. It empowers another woman who may still be holding her questions in secret. If you found this conversation helpful, please consider joining us weekly at the Female Health Hub, where we continue to illuminate the truths about women's health that are often left unspoken. Let us keep learning, supporting one another, and reminding ourselves that our bodies are wise, Our experiences matter, and we are never too old to feel fresh, vibrant, and at home in ourselves.